So people cannot get sick from the flu shot itself. Getting the flu shot will not give you the flu virus. That's a common misconception that people have. The way that the vaccine is developed, it's pieces of the virus, so it can't reform and make you sick. I think that's something that people have a kind of a hard time visualizing without having that sort of scientific background. But it can't make you sick. That said, if you do feel a little bit under the weather after you get the vaccine, it's more than likely your body developing an immune response against the vaccine, so that way when you do actually get exposed to the real thing, your body knows exactly what to do and can mount a really strong immune response. So if you feel a little bit under the weather, that's a good thing. That means your immune system is doing what it should. Now, if you come down with what seems like a cold, or you feel the aches, you feel the chills, and it does last more than a couple days, it's more than likely due to the fact that you got something right before you got the vaccine. And so viruses, they take a little bit while to, we call it to incubate, to kind of bake within you, so to speak. And some can take a day, some can take 3 days. So it could be too that you just got exposed to something and the two aren't related. One does not equal the other. The flu shot is effective. Granted, it's not 100% effective, and it really can't be that way just based off how the virus is, but the flu shot is effective at reducing the severity of illness and at reducing duration if you do happen to get the flu during the flu season after getting vaccinated. The flu shot is absolutely safe for children. Children is one of the main populations that we really want to make sure are vaccinated during the flu season. Especially the younger children, they still have, their immune systems are still learning, they're still developing, so they can still be a little bit more susceptible to severe side effects after getting sick. So we really want to make sure they are vaccinated. Children can be vaccinated as young as the age of 6 months, and so we encourage any infants, babies around that age, to be vaccinated as soon as possible, as long as their healthcare provider is on board. And then we advise anyone who's going to be around children before they're 6 months to be vaccinated, because these children, you're at a vulnerable state. Your immune system is just starting to develop, and if your child has any underlying chronic illnesses that you are concerned about for them getting vaccinated, talk to your healthcare provider, and they may be able to find alternatives that for your child, so that way they can still be vaccinated and be protected against this year's flu. This kind of goes back to the idea that flu shots admittedly are only between 40 to 60% effective on any given year. Sometimes they're more effective, sometimes they're less effective. There could be some strains that are circulating that no one saw coming, and so they weren't covered in the vaccine. This is a really rare scenario. What you should realize if you do get the virus after getting vaccinated is that your disease, you'll likely be less sick, and you'll be sick for a shorter period of time compared to if you didn't get the vaccine and then you got the flu. We really want to try to keep people out of the hospitals, and getting the vaccine is one of the main ways that we can help keep people from being hospitalized due to influenza. The CDC estimates every year that millions of people don't see a healthcare provider after they've been vaccinated because they don't need to. They get sick and they recover in 3 days and they don't see a need to go see someone. And that's great. We want to try to keep people healthy as possible. The flu shot is important because ultimately, in the immediate time you're protecting yourself, but you're protecting your loved ones, you're protecting your friends, your coworkers. There are people around us who truly can't be vaccinated for whatever underlying medical reason. And they are the people who are most vulnerable to these circulating illnesses. We call it herd immunity. So if you protect yourself, and if the bulk of you in your community are vaccinated, viruses can't jump around from person to person. And if they can't jump as fast, then they might not be able to it would reduce the chances of them getting to that 1 or 2 sick individuals that you may know. So kind of like we say with young children who can't be vaccinated until they're 6 months old, if we want to protect them, we have to protect ourselves first. If you've been sick for more than 5 days, or your your symptoms are getting worse and not better, your fever isn't going away, definitely seek health care attention immediately. Go to your nearest emergency room or try to get in to see our primary care provider as soon as possible. Most people, when they are hospitalized with influenza, it's not due to the virus itself, but it's due to a secondary infection, so like a bacterial pneumonia. And that's when healthcare intervention is absolutely critical. So for young kids, if they, even if it's been under 5 days, just get them looked at. It's better to be safe, than regret it later. But for any, individual who was, who was healthy prior, and you're just not getting better, you can't keep liquids down, or any of the things I mentioned before, definitely go seek medical attention as soon as absolutely possible.